All right, good afternoon. My name is Craig. I'm going to be the nurse practitioner assessing you today. Is it okay if I assess you one-on-one? All right, I just washed my hands. I'm going to start by working my way from the top to the bottom. So first I'm going to take a look at her scalp. Scalp looks good on inspection. No mites, no redness noted, no dryness, no lesions. Everything looks good. No abnormalities noted. I'm going to work my way down to your face. Skin looks normal for ethnicity. I'm going to ask you to close your eyes for me. Can you open them against mine? Okay, good. And now close your eyes once more. Tell me where I'm touching you on your face.
Forehead. Left cheek. Right cheek.
Okay, now open your eyes. Raise your eyebrows. Smile. Smile is symmetrical. Eyes are symmetrical in movement. Cranial nerves 5 and 7 tested and intact. Looking at the eyes, they look symmetrical. I'm going to look at the eyelashes and the eyelids. Eyelashes look good. Hair growth is there, intact. No dryness noted. No drainage noted bilaterally. Everything looks good for your eyes there. The next thing I'm going to do is I'm going to have you follow my finger with just your eyes. So keep your head midline and follow my finger, okay? Good. Cranial nerves 3, 5, and 6 are intact. Next thing we're going to do is we're going to take a look at your eyes with a light, okay? So what I want you to do is I want you to look straight forward at my light, and I want you to just stare straight. Good. Corneal light reflex is equal bilaterally, no issues. Next thing I'm going to check for is constriction. So I'm going to go one eye at a time, so just look straight forward. Pupils are equal, round, and reactive to light. I'm going to take a look into your eye. Look straight forward for me. Good. Okay. Optic disc is creamy pink. No issues noted. No retinal hemorrhages. No abnormalities found. Next thing I want to do is I think we're going to take a look at your nose, which looks symmetrical, no growths noted, no lesions. Any pain on palpation? Okay. Next thing we're going to do is I'm going to take a look inside your nose. Look up for me. Okay, no deviation in septum. Turbinates are a nice pink purple. No deviation on septum. Turbinates are a nice pink purple. Okay, good. And sclera is also noted as white, no abnormalities. I'm gonna palpate your sinuses. I'm going to do your frontal first to let me know if you feel any pain.
No.
And maxillary? Any pain?
No.
No crackles noted, no exudate, no abnormalities found. No nasal drainage noted. And I want you to take a smell of this. You smell it? Okay. Cranial nerve 1 is intact. Next thing we're going to do is we're going to take a look at your ears. So look straight for me. I'm going to put your hair behind your ears here. And looking head on to the patient, ears are symmetrical. No redness noted to the external, to the pinna or the tragus. I'm going to palpate them both. Any pain?
No.
Okay, good. I'm going to take a look into your ear canal. So I'm going to pull the pinna up, out, and back. Up. Ear canal is good, no redness noted. Tympanic membrane is intact, no discharge, and it is pearly pink. Up, out, and back again. No redness to the ear canal. Tympanic membrane's intact, pearly pale pink. Okay, good. Now I'm going to do a couple of tests with the tuning fork. First one is the Weber test. I'm going to put the tuning fork to the center of your ear, or to the center of your face. You're going to tell me if you hear the tone sound stronger on the right side or the left side, or if it's even, okay?
Even.
Even, okay. No lateralization noted. So next is the Rhines test. I'm going to make another sound. I'm going to put it on the back behind your ear on the mastoid bone. You tell me when you stop hearing it there. I'm going to move it to the front of your ear. You tell me when you stop hearing it there, okay? I'm going to do it both sides. First one.
Stop. Stop.
Okay.
Stop. Stop.
Okay. Rhines test is good. No abnormalities noted. Air conduction is twice as long as bone conduction. Last thing I'm going to do is a whisper test. I need you to cover your tragus on your right ear. And I'm going to whisper words to you. I need you to repeat them to me, okay?
99. 77. 66.
Okay, good. Now the other ear.
77. 45. 32.
Good. Okay. Whisper test is negative. Next thing we're going to do is we're going to look at the mouth and the throat. So smile for me again. Okay. Teeth look good. All teeth intact. Lips are symmetrical and pink. No lesions noted. Can you open up your mouth for me? Okay, good. Taking a look at the tongue. No lesions noted. Can you stick your tongue out for me? Okay. Cranial nerve 12 intact. Move your tongue to the left. To the right. Lift it up. Good. No lesions noted underneath the tongue or on the tongue. Now tilt your head slightly up. I'm going to take a look at your palates. No lesions noted. Hard palate is pale. Soft palate is a nice light pink. Say ah for me.
Ah.
Uvula moves up in midline. So cranial nerves 9 and 10 intact. Can you swallow for me? Cranial nerve 9 intact again. Going to take a look at your tonsils. Say ah for me.
Ah.
Tonsils are non-enlarged, no white exudate, pink, symmetrical, and the throat also looks pink, no lesions noted. I put something sweet on this tongue depressor here. I need you to tell me if you taste it.
Uh-huh.
Okay, good. So once again, cranial nerve 7 and 9 are intact. Next thing we're going to do is we're going to move on to your neck. I'm going to palpate your lymph nodes. So in front of your ears, behind your ears, under your jaw, and under your chin. Let me know if you feel any tenderness. Do you feel any pain?
No.
Okay, so lymph nodes are non-palpable and non-tender. I'm going to take a look at the skin on the neck. It looks good. No lesions. Can you tilt your chin up for me? Okay, I'm going to palpate. Trachea looks midline. Feels midline. Intact. I'm going to palpate your carotid arteries one at a time. Left side amplitude is +2. Right side amplitude is +2. Now I'm going to displace your trachea off to the side here so I can better palpate your thyroid, okay? I'm going to do it on both sides. Thyroid is non-enlarged on the right lobe. No nodules felt. Thyroid is non-enlarged on the left side. No nodules felt. Okay. Now I'm going to auscultate your carotid and your thyroid, looking for bruits. No bruit noted in either carotid artery. No bruit noted in thyroid. Okay, now I'm going to work on your chest, okay? So you can turn around for me. I'll start on the back side and move your hair. So you can just breathe normal. I'm just going to assess for chest wall rise and fall. Chest is rising and falling symmetrically. Going to palpate now. Check for tactile firmitis. Can you say the words after me? 99.
99.
Staircase.
Staircase.
Dreamwalker.
Dreamwalker.
Okay, tactile firmitis is even. Bilaterally, no increase or decrease noted, no abnormalities. I'm going to percuss in the lung fields now. Resonance noted in all lung fields, no abnormalities found. Next thing I'm going to do is diaphragmatic excursion, so I'm going to lift your shirt up. Hold your breath for me. Okay, marking where the end of the diaphragm is. Now I'm going to work my way back up. Good, okay, you can breathe again. Diaphragmatic excursion is 4 centimeters. Now I'm going to listen to all lung fields posteriorly. And take a couple deep breaths for me. Good. Lung sounds are present and clear in all fields, no adventitious lung sounds. Okay, I'm going to have you turn around for me so I can do the anterior. Go ahead and breathe normally for me. I'm just assessing, inspecting to make sure that chest wall rises and falls symmetrically. No abnormalities noted. Patient's respiratory rate is unlabored and normal. I'm going to palpate to make sure chest wall rises and falls symmetrically. No abnormalities noted. I'm going to listen to lung sounds on the front now. You can take a deep breath for me. Good. Lung sounds are present and clear bilaterally, no adventitious lung sounds. I'm going to move on to cardiac review now. So first thing I want to do is I'm going to look for JVD. So I want you to have your legs up like you are and then lay back at a 45-degree angle. I'm going to have you turn your head to the right side. No JVD noted on the left. Go ahead and now do the same onto the opposite side. No JVD noted on the right side. So next thing I'm going to do is I'm going to listen to your heart sounds. I'm going to start listening to the aortic valve. Now the pulmonic. Erb's point. Tricuspid. And the mitral valve. S1 and S2 noted. No extra heart sounds, no atrial gallop or ventricular gallop. Now I'm going to auscultate and palpate your renal, iliac, and femoral arteries and aortic. So first I'm going to start with the aortic. No thrill noted. Next I'm going to start with the renal. It's above the belly button. No thrill noted bilaterally. Iliac, below the umbilicus. No thrill noted bilaterally, and femoral arteries. No thrill noted bilaterally. I'm going to auscultate for all of them now. No Bury noted for aortic. No Bury noted for renal bilaterally. No Bury noted for iliac bilaterally. No Bury noted for femoral bilaterally. Last thing I'm going to do is I'm going to check your capillary refill in your fingers and your toes and check your pulses. I'm going to start with your left hand. Capillary refill less than 3 seconds on the left hand. Capillary refill less than 3 seconds on the right hand. Radial artery is +2 amplitude on the left. Brachial artery +2 amplitude on the right, or on the left. Radial artery amplitude +2 on the left, on the right. Brachial artery +2 amplitude on the right. Work my way down. Popliteal +2 amplitude on the left. Popliteal artery on the right, amplitude is +2. Posterior tibialis Left side amplitude +2. Right side amplitude +2. Dorsalis pedis pulse. Left side +2 amplitude. Right side +2 amplitude. And check for capillary refill. Patient has nail polish. A little hard to see, but extremities are warm to the touch. Do you feel me touching here? Sensation intact, warm and dry. Circulation looks good.